But welcome to Public Health. My name is Dr. Beth Lanning. I am actually the Associate Chair of the Department of Public Health, and I'm hoping my slides will go forward. So you're just going to have to, there we go. Great. So again, my name is Dr. Beth Lanning. I'm Associate Chair of the department. I was the undergrad coordinator for over 14 years. And so now I work more with the master's level, but I also do quite a bit with the undergrad. So I'm so glad that you're here and that you're thinking about public health. So let me start right into it. I got a little video, so hopefully this video will work. So we'll give it a good try. Let's see if it'll come up. Can you hear it? No? So you could not hear it? I think I have to, in Zoom, you have to do the video using the same computer. I'm not sure how to do it when we're in a webinar. Let me, oops. I think I have to go back out, Nathan. I don't know if you can do it on your side, probably not, because it has to use the same computer as mine. So let me stop sharing and see if I can. I'm sorry, everyone. We had two videos that we use. They usually work in the online version. You know what, just for time's sake, I'm just going to go forward and not worry about, we have some great videos. So let me go back. And screen save, sure. So there we are, we should be back to, I'm just going to move forward. There's two videos and actually the links are on our website. So you can go to baylor.edu. public health /, and so you can actually get to these extra videos. So I apologize that they're not showing up in this or you can't hear them. And so let me go ahead and just move forward so that we can get to questions and answers and those kinds of things. So first of all, public health is really the science of helping people. We work a lot from what we call the macro level, which means we look at the whole community. We realize that communities are made up of people, individuals, but we really kind of step back and look at the whole picture. We strongly believe that every person has the right to living a healthy life. Doesn't mean we all have perfect lives, but we have a right to at least a healthy life. And so we work very diligently in those areas, everything that connects public health to quality of life. Let me talk a little bit more about kind of where we try and have our largest impact. You can see from the public health impact pyramid here that I'm showing on the screen that when you address the top part of the pyramid, you're looking at counseling and individual work, which is critically important. And so we love our counselors and we love our physicians that work more on one-on-one. But for public health, we actually work at the bottom there, more of the socioeconomic factors, looking at what we call social determinants of health. We really look at what small changes or even large changes in the community and the environment, how that can impact multiple people and populations. So those have the largest impact over the highest number of people. And so we work in all areas, but predominantly in the larger segments, trying to make systemic type of changes. There's another message here, and you'll have to, again, you can go to our website and click on that, but there's no sense going through it without the volume, and you can hear, but that's a little bit of a video that I did talking a little bit more about what public health is, so I hope you'll watch that later. So public health specialists are trained to act in partnership with other healthcare workers. We work with our physicians, our PAs, our nurses. We work with all of those we think of more traditional healthcare settings. Many of our public health students actually go on to get degrees, an MD or a DO degree, or work as PAs. We have some that go into OT and PT and all those different areas. So public health is a great foundation for additional studies and also into other professions. We think very big picture, as I mentioned. We actually use what we call systems thinking, which means that when we step back, we realize that everything is connected to something else, and that when you make changes in one area, that has an effect on another area. So we really kind of look at complex problems that are sometimes they call them wicked problems, and those are just big, large public health issues. And we look at those and try and dissect those to figure out what are the critical components that we can influence that will make a difference for the whole. We treat the person not as a patient with a problem, but a person with a life. And it's not to say that physicians treat people or patients as patients with just problems. They realize that they're also part of a bigger network, but physicians don't have time to spend with that. They do diagnosis and they help the individual immensely, but we actually step back and realize that this person is part of a larger network, and that what we teach and what we do is going to affect not only just a person, but their family, the community, and even policy. We really work from a position of empowerment. We believe in the person doing the work. As I tell my students, it always starts with the community and it ends with the community. And so it's not that the community becomes dependent on you as a public health specialist. It's that we empower people and we work alongside communities so that we can all work together to make a sustainable changes in that particular community. So healthcare specialists, where do they work? They work in the healthcare environment. As I said, some of our public health students will go on even after their bachelor's, or they'll go on after they're getting their master's of public health, and they'll go on to professional schools and work in a healthcare setting. Some stay even with just the MPH and work in healthcare settings, working in community outreach, working in different levels of what we call population health, which is that area between the healthcare systems and the community health. Some of them, public health workers, work in schools. They may work with school health programs. They may work for the whole ISD or over the whole city, working to help implement healthy curriculum, also healthy activities. We also work in private business. Some public health specialists work for pharmaceutical companies. They do health coaching. They may do health communication. That's a huge area right now, especially with COVID. We've learned how much that people are influenced by not only facts, but also misguided information as well. And so public health specialists will step into that arena and work on health messaging, making sure that we are using the right kinds of messaging tools to get the information out to the community so that the community members can make educated decisions about their health. We work in public health institutions where, like the McLennan County Health District, our local, our state, even national or global. Might work for, the World Health Organization, might work for CDC, might work for, like I said, McLennan County Health District, different kinds of public health entities. And then also they work for a lot of nonprofits, American Heart Association, Ag Life, might work for CareNet is one that we've got. Students have actually gone to work for other organizations, NGOs in other parts of the world. And so the field is huge, different places that you can actually use your skills that we are teaching you in Baylor. So one of the things I think is always important, and as parents out there, that you want to know is, will I get a job? And the good news is that while I can't guarantee a job for everybody, I can tell you from the history and what's going on nationally as well as at Baylor is that students who major in public health do get a job. And we see that 57% nationally, 57% of the students actually go on to employment right out of their bachelor's degree, and others, another 38% enroll in further education, which means they're getting into PA schools, they're getting into the medical schools, OT schools. And so this becomes a major that not only is a major that is what I call a marketable major, which means that you have skills that actually make you marketable for a job right out of your undergrad, but you also are also highly sought after as far as a student going into the medical field. In fact, if you look at a lot of physicians, they might have an MPH as a degree, which is a Master's of Public Health before their MD. A lot of medical schools can also offer a dual degree where you can get an MPH and MD. So that kind of tells you how much the public health is actually valued in the medical society. So over in the box over to the right, you'll see some of the areas where our students have gone to work. Again, they work for public health departments. We have several in that area. We have on the nonprofits. We have some in hospitals. Some are there in global health. Many of them are accepted on into MPH programs. Beyond this, we have students that are into law. Some students want to go into public health policy and law, and so they go that direction. In fact, I just chatted with one of my former alumni, and she's been working in a law firm for 4 years because she went on from her undergrad at Baylor to a dual degree program. It was an MPH and a JD degree program, and then now is out practicing health policy law and enjoying it. Some go on to nursing school after this as well. So there's lots that you can do. Again, another great video that I can't show. I apologize. I wish that we had those ready to go. So let me tell you a little bit about the degree program. We do offer, like I said, a Bachelor of Science in Public Health. This is a 4-year degree like all other our degrees at Baylor. It's 124 semester hours, and you would take some very core science courses as well as core public health development courses. And then you graduate with a Bachelor of Science in Public Health. We also offer an MPH, a Master of Public Health program at Baylor with 3 different concentrations. One is called Community Health, one is called Environmental Health Science, and then Epidemiology. That is a 42-hour or a 2-year cohort type of a program. We have scholarships available for that program, which is very nice, where the tuition can be covered. 75% of the tuition, and even up to 100% in some cases, can be covered for your master's program. We also offer a dual degree, or we call a joint degree. It's a 5-year degree, and that is a BSPH and an MPH in community health. Through the environmental health science area, they offer a dual degree through, if you get an undergrad in environmental health science and then get an MPH in environmental health science. We don't have one for epidemiology at this time. So back to the BSPH, MPH, that community health program or that joint degree program is a 5-year program. So after 5 years, you actually walk the stage and you get 2 diplomas. You get your BSPH and then you get your Master's of Public Health. And so we've integrated that so that you have about 15 hours of coursework that counts for both your bachelor's program and also your master's program. So that's a program that you would be talking to the advisors as you go through. You have to be accepted into the graduate school. So there's some stipulations. Your GPA has to be high, and you have to take a GRE and some of those other types of things to be accepted. But we have 2 or 3 students every year that matriculate into our MPH program as joint degree students. So that's something to think about. So a couple of places where you can find out more about us and kind of keep track of us. We like to post a lot of information on our Facebook page and also on Instagram. And then we have a student organization on campus too. It's called Bears for Public Health. And this is open to all majors, but obviously it's the public health emphasis. So anybody who is interested in public health can join that and learn more about it. So this is ways that you can stay connected with us and to see what's going on. And I'm going to go ahead and stop. Oh, well, let me go ahead and put this up there. Mrs. Margot Shanks is our director of the program, the undergrad program. So she would be a great person to contact. And so you can see her email address there as well as her phone number. We are located in the Robbins College. And again, we are the Department of Public Health. So let me go ahead and stop there. Stop sharing. And see if we have any questions. I know I went through fast, but I was catching up. Oh, I see some questions. Yeah. So Nathan, do you want to read those to me or?
Yeah, sure. I'll read them. I just want to let you know if you guys do have questions, put them in the Q&A box so that we can see them and answer them from there. But the first question we have is, does public health associate with dental?
Oh, for being pre-dent. I actually have had 1 or 2 students have done that. The way that our program works is because we have some electives within our major. That's where a lot of your pre-med requirements would fit into. Some of the pre-med requirements and the pre-dent and some of those requirements fit nicely into our major. Others are kind of in the peripheral, which means you might have to take a couple of extra classes. But as you know, with pre-med or pre-dent, there's no such thing as a major for pre-med or pre-dent. There's pre-med requirements that you can take in as part of other majors. So you can be any major and still be pre-med. So we want to make sure people really clearly understand that, because a lot of people think, oh, I'm going to major in pre-med. Nobody majors in pre-med or pre-dent. It's just part of the requirements. So yes, there is definitely some ways that you can do that. And I've had a couple of students who have done that and gone on to dental school.
Cool. Our next question, is the BSPH/MPH program the same as the BSMD program? If not, what's the difference?
The BS, which program was that?
The BSPH/MPH program. You can see it if you click the Q&A. You should be able
Yeah,
to
let me
see
do the Q&A and see what we've got here.
Yeah.
I have no idea what the MSBD program is, so I'm not familiar with that. We have the only public health degree on campus. So if you want public health, I don't know what BD.
The BSBD, maybe you meant MD. Oh yes, sorry, BSMD program. So like the Baylor to Baylor medical program, that's actually a scholarship program that students can apply for. And they would do 4 years at Baylor and 4 years at Baylor College of Medicine in Houston.
Yes.
So those are different. Yes.
Yes, those are very different. Yeah. Yeah. And I've actually been on the review, or I've reviewed some of those applications coming in on those before. Yes. But that is not the same program. Right.
Yeah. And whoever answered or asked that will be something you can apply through the scholarships program webpage. You can look that up on Baylor's website. And the last question before we have to end this, if I want to do research for the impact of the environment on health, is public health the best place, or is environmental science a better fit?
That's a great question, and I think you could approach it from both directions. If you're very interested in just surely the environmental health and looking at toxicology and water treatments and all those kinds of things, I would suggest more of the environmental health side to start with, and then you could go for the joint program that's through our MPH environmental health part as well. So.
Thank you so much, Dr. Lanning. This was really good, super helpful for me. I hope it was helpful for everyone else here. Thank you guys so much, and y'all have a good day.